I'm just starting on the research that we have to do for our assignment.
Oh, right. Yeah, I don't even know what's the topic.
Oh, the topic is IUIH home support.
IUIH home support? Yeah, it sounds like it.
But anyway, what is my aged care?
Right. My aged care is, as I say, is a home service pathway.
Yeah.
And I have a brochure here. They actually cover everything. I mean, really,
Yeah.
everything. They have the in-home support, and they have respite options, and they also provide, if you need, to go to a nursing home. I also have a chat with the aged care manager in IUIH, and she told me that their clients will either receive an entry level of funding for a Commonwealth home support program or a home care package program.
All right. The National Aboriginal and Torres Strait Islander Flexible Aged Care Program. So it's more flexible program. Maybe for a remote area, Aboriginal and Torres Strait Islander. I think maybe people might say, why don't we just put them into an aged care facility? Because it's easier and safer.
I wonder why we put so much funding for people to live at home. Maybe I should ask the Indigenous health social worker about that.
I think that kind of links back to our older people, our people being taken away from their homes and their communities and their country through legislation with the stolen generation, and essentially providing in-home care to Aboriginal and Torres Strait Islander people is about not displacing them from their familiar surroundings and environment. The people eligible for home support in aged care would generally be those affected by the stolen generation and supporting them at home, as opposed to removing them to an aged care situation will trigger the trauma experience from being removed in an earlier time frame.
So that was really interesting what she said about not displacing people again. Makes sense, you know?
Yeah, and I think that really made me see the importance of a sufficient home support service for
Yeah.
Indigenous
Yeah.
people.
Absolutely. The 50 years old for the...
Yeah, so according to the studies, the Aboriginal and Torres Strait Islander, they're actually more likely to be affected by age-associated health issues compared with other Australians, and that's why the legislation in Aged Care Act 1997 outlined that it is their goal to facilitate access to aged care service by those who need them, regardless of race, culture, language, gender, economy, circumstances, or geographic location.
age 50. So
Oh, what is that?
that's Cotter et al. In 2013 found that a lot of the funding for younger Aboriginal people in their low 50s, they don't really access those aged care services, but they do have a much higher prevalence and early onset of preventable chronic conditions.
Across Indigenous focused provider has been higher than for mainstream provider. So, which means the client were serviced through Commonwealth Home Care Program.
Yeah.
They actually grant funding despite being assessed as having more complex health needs that are beyond the intent scope of the program.
What?
I mean,
Yeah.
it means that I actually need a
Yeah.
lot more than what I
Yeah.
receive. Have limited distribution of the flexible program that's limited potential for new provider to access the program.
Oh boy.
Well, I feel really bad right now. So, is there anything we can improve or help these elders live in the community?
That.
Yeah, I think it's a more cultural sensitive practice, is it?
Yeah.
I hear this similar things from the IUIH. I think she's a service development officer, and she suggests that recruitment is essential in my age care.
Yep.
Yeah, and provide adequate cultural safety training prior to work with the clients, and that's what they do in IUIH.
And I have 2 more recommendations.
You have more.
Even more. So,
We are on fire.
So, one has to do with healthy housing.
Oh,
Yeah.
what's it do with housing?
Well, it's a really important part of Close the Gap. So, especially with home services, because, it's not just about infrastructure. I mean, that's important. It's important to provide those healthy homes, but it's also important to provide the social and public health programs that feed into that healthy kind of living.
Seems like we need to provide some education
Yeah.
on that regard.
Yeah, so the second recommendation is along those lines, an arts program to help people understand what healthy living, healthy homes, what that might feel like, what that might be like. Also, there's a study going on right now through Flinders University about how to incorporate the spiritual and cultural connections for the Aboriginal and Torres Strait Islander people who use the home care.
Yeah, so because I guess spirit is really important in Aboriginal culture.
Yes.
Yeah, now think about that. There are actually a lot of things we can do. I feel much better now.
Do you think people might have any questions?
Yeah, maybe.
Mm-hmm.
What about let's ask them?
Okay.
Questions?